I know we're a little bit behind on time, so I'm just going to jump right into it. My name is Jason Hart. I'm the Communications Director for MediaTrackers here in Ohio. MediaTrackers is a national, nonpartisan, conservative nonprofit. There are two of us in the state of Ohio, so we try and cover a certain amount of depth and breadth, but obviously it's a big state for two people to cover, so there's a lot that we miss. But one of the topics that I've been really focused on is Medicaid expansion, and the reason why I think is pretty well summarized in the title that I gave my presentation here. If you look at this completely, obviously ridiculous phrase, that fairly well sums up the coverage that we've gotten about Medicaid expansion in the press. So if you think that Medicaid expansion is free money, that Washington is going to provide all of this money to boost the state's economy, to create jobs in the healthcare industry, to improve the health of Ohioans, then I'm going to maybe disabuse you of some of those notions in the next few minutes here. So I'm going to talk about just the basics of what Medicaid expansion is. I'm going to review some of the talking points that the Kasich administration and by extension the Ohio Republican Party have used to try and push Medicaid expansion. I'm going to do kind of a recap of what the press coverage of this issue has looked like, and then Greg from the Buckeye Institute is going to dig into a little bit more meat and potatoes. Here's the actual numbers behind it. Here are some studies that you may not have heard anything about. So without further ado, Medicaid expansion is a central piece of the 2010 Patient Protection and Affordable Care Act, more commonly referred to as Obamacare. There are two key things that Obamacare does with the intent, or at least with the stated intent, of making sure that everybody in America has health insurance coverage. One of those is the Obamacare exchanges. If you are at or below 400% of the federal poverty line, you qualify for certain subsidies to purchase government-approved healthcare policies on the Obamacare exchanges. But the other major piece of Obamacare is expanding Medicaid. As the law was written, Medicaid expansion to 138% of the federal poverty line was required in order for states to continue receiving their existing Medicaid funding. So the law was really written to put states over a barrel. You can expand Medicaid and you'll continue to get your funding that you're currently receiving, plus you'll receive additional funding for this newly eligible population, or you cannot expand Medicaid, and we're going to cut off the billions of dollars per year that your state is currently receiving to cover Medicaid-eligible people. So the Left-Leaning Urban Institute, and this is a really important statistic, the Left-Leaning Urban Institute estimates that roughly 90%, I think it's 89.7%, they estimate, of the Medicaid expansion population would be able-bodied, childless adults. So Medicaid is a program designed to serve the absolutely neediest of the needy, poor families, the disabled, pregnant mothers, and Medicaid expansion just takes all of that and throws it out the window. Everyone under a certain income level becomes eligible for Medicaid under the Medicaid expansion. It completely turns on its head the notion of Medicaid being a specifically targeted program that, again, serves only the most vulnerable populations, and it makes it a much more wide-reaching entitlement program. So why are we discussing this? Obamacare, as we're reminded on probably a daily basis, is the law of the land now. And if Obamacare was written to expand Medicaid, well, Medicaid is expanded. In 2012, the Supreme Court ruled on a case where Ohio was a plaintiff. We joined Florida and 24 other states in suing the Federal Department of Health and Human Services, saying basically it's unconstitutional for you to require states to expand Medicaid to a new population in order to receive their existing Medicaid funding. That was, from a conservative perspective, the one bit of silver lining around the ruling from the U.S. Supreme Court in June of 2012. The Supreme Court said, yeah, the states are right. The federal government cannot require a state to expand Medicaid to a new population in order to receive their existing Medicaid funding. So states, with that ruling from the Supreme Court, were given the option to reject Medicaid expansion, and you wouldn't receive all of the free money from the federal government to cover that newly eligible population, but you also wouldn't forfeit your existing Medicaid funding. So it seems like it's pretty cut and dry, because doesn't Ohio have a conservative governor? In 2010, come on, let's be nice. And in early 2010, this is a quote from Governor Kasich while he was still gubernatorial candidate John Kasich. "I think I was in the Tea Party before there was a Tea Party." A couple of months after that, when the Patient Protection and Affordable Care Act passed, Governor Kasich, again, while he was running for governor, said, "Instead of letting states develop innovative solutions to their respective challenges, new federal mandates will require more Medicaid spending and stick states with large and unsustainable costs," which is a pretty accurate description of the scenario. So in 2010, when states didn't have the option, Governor Kasich, running as a conservative Tea Party Republican, said that Obamacare would, again, stick states with large and unsustainable costs. And that's specifically Medicaid expansion he's discussing here. It's very clear from the quote. Now that states have the ability to opt out, Governor Kasich has strangely changed his tune. So everyone here, I think, is probably pretty familiar with the level of unpopularity that Obamacare faces. So Governor Kasich knows that as well. Governor Kasich, when he announced his budget plan for fiscal years 2014 and 2015, the Medicaid expansion was part of that budget plan. And I'm not an expert, I don't claim to read minds, but my assumption is Governor Kasich thought that he was going to twist some arms, he was going to ram that through as part of the budget process, and the uproar from the conservative grassroots would die down, but the acclaim that he would receive from the press and from the labor unions and the hospital lobbying group and all of the other business lobbies that want more of that, again, free money, would carry on through his 2014 election campaign. When that didn't happen, Governor Kasich has actually made efforts to say the Obamacare Medicaid expansion is separate from Obamacare. And these are direct quotes. "This is not about Obamacare," Governor Kasich told reporters in July. He also told reporters, "Medicaid expansion is no different than the current Medicaid program. And to try to tie Medicaid to Obamacare, I don't see the connection." Every dollar that Ohio would receive as a result of enacting the Obamacare Medicaid expansion would come to the state as a direct result of the Patient Protection and Affordable Care Act. There is no separation. Medicaid expansion is a central component of Obamacare. So when Governor Kasich tries to say that you've got these Tea Party people who are worked up about Obamacare and they just need to understand that this is separate, it is not separate.